If you're 50 or older in Canada, it's now being recommended by the National Advisory Committee on Immunization that you get a booster shot. Although the country's chief medical officer says that the new guidelines were in the works even before Omicron became a variant of concern.
There is certainly a direction of travel in terms of the waning of the vaccine's effectiveness over time against asymptomatic infection and any symptoms. So that's why I think the recommendation is stratified.
Canada's top doctor says it's time for those 50 plus to get their COVID boosters in order to be better protected against the virus and its variants, but that it's better for those younger to wait. NACI suggesting that booster shots only be offered to adults 18 to 49 years old at least 6 months after their second dose, and that they should be mRNA vaccines. Frontline healthcare workers, those fully vaccinated with AstraZeneca or Johnson & Johnson shots, or those living in Indigenous communities would otherwise qualify.
The data that we have at the moment shows that the vaccines are holding up pretty good against severe outcomes. We're most concerned about severe outcomes in those who are elderly or have other higher risk conditions.
While Tam claims the timing of the new recommendations and the Omicron variant becoming more prominent is coincidental, the move comes just days after the federal government made an urgent request for more direction.
There is much we do not know about this new variant, Omicron. What we do know is that vaccination remains one of the most effective ways to protect our families, our communities, and ourselves against the variants of COVID-19 currently circulating on our planet.
Different provinces have started rolling out their own strategies for booster shots based on increased COVID cases. Some are in line with the new NACI suggestions, others willing to offer a third dose to younger age groups or more vulnerable groups only at this point.
I think there is a need, and I would say even a responsibility for NACI at the federal level to help provinces come closer together.
Of note as well, the federal government has received nearly 3 million pediatric doses of vaccines for children aged 5 to 11, enough for at least one shot for all of Canada at this point. Mark McAllister, City News.